Okay, welcome back to the Busting Lung Cancer Myths. So we are the Lung Buster. We're going to talk about some interesting lung cancer myths that are really popular these days. Okay, so let's first talk why lung cancer. Okay, so lung cancer currently is the most common cancer and leading cause of cancer death worldwide, with over 2.4 million new cases and 1.8 million deaths in 2022 being traced back to lung cancer. So these two things make lung cancer patients difficult to find and treat, which is social stigma and the misinformation. So let's talk more into about lung cancer. What is lung cancer? So this lung cancer is a disease where abnormal cells in the lungs grow uncontrollably. So there are two types of lung cancer here. First is the non-small cell lung cancer and the small cell lung cancer. So there are some of some symptoms about lung cancer, which one is persistent cough or changes in a chronic cough, chest pains, especially when breathing deeply or coughing, and then shortness of breath and or wheezing. Next is unexplained weight loss or fatigue, and cough of blood. So you can get these diagnoses back to the hospital, so don't self-diagnose on your own. So let's keep in mind that early diagnosis equals to better outcomes. So let's talk about the risk of lung cancer. So what are these risks? I'm going to mention 5 top risks here, which first is, of course, smoking. And next is air pollution, which is now very, very popular in Indonesia, especially. And next is inherited genes from your families. This one is a bit rare, but next is radiation. But the one who is not so rare in Indonesia, I think it's alcohol. Okay, let's go ahead and talk about why smoking. So here, let's talk about tobacco use, which is the leading cause of lung cancer and lung cancer deaths. So smoking is a greater risk factor for lung cancer than genetics, which means that many lung cancer deaths are considered preventable. So let's see a data here that Indonesia is one of only 6 countries where tobacco use is still rising, according to a 2022 WHO report. So the age standardized prevalence of tobacco use in Indonesian males is around 70.8%, and corresponding with a younger average age of lung cancer diagnosis.
With how common lung cancer is, it is very likely that misinformation can propagate, making the treatment of lung cancer much more difficult. Here we are going to cover 6 common myths that people believe about lung cancer that make the diagnosis and treatment of it a little more difficult. Myth number 1 is that only smokers can get lung cancer. Unfortunately, up to 20% of lung cancer cases occur in people who have never smoked. These are people who have smoked fewer than 100 cigarettes in their lifetime, or even none at all. This includes young adults, mainly includes women, and includes people with no known risk factors for lung cancer. Lung cancer can happen to anyone, even if they don't smoke, but that doesn't mean that anyone deserves it, of course. Myth number 2 is that lung cancer is always a death sentence. Thankfully, these days, lung cancer is very treatable, with their chance of surviving at least 5 years going up as high as 70%. But this is mainly if you can get this lung cancer diagnosed early, which means it is very important that if you experience any symptoms, you should try and visit a doctor as soon as possible and get screened for it. Myth number 3 is that only older people develop lung cancer. Now, it is true that lung cancer primarily affects older people, but lung cancer in younger patients has over time become more dominant. In Indonesia in particular, most lung cancer patients are at least 55 years old, but the number of new cases in people under this age 20 to 54, is much higher. This is 29% higher for men and 36% higher for women. Myth number 4 is that lung cancer has to come with symptoms, that if you don't have symptoms, you don't necessarily have lung cancer. You should be worried about lung cancer even when you don't show symptoms, especially if you're a smoker, because almost 60% with stage 1 lung cancer, compared to 24% of people with stage 4 lung cancer, don't show any symptoms when they were diagnosed, meaning that they had to discover their lung cancer through screening in the hospital. In a qualitative study in 2021, people often misidentified or ignored symptoms of early-stage lung cancer, thinking that they were signs of other more normal illnesses like cold. And they believed that they would get better over time, and eventually they were diagnosed with lung cancer. By the time lung cancer shows noticeable symptoms, it might already be in a late stage. And by this point, the effectiveness of treatment goes down much lower. Myth number 5 is that vaping is a safer alternative that does not cause lung cancer. Well, it is true that vaping is a safer alternative, but that doesn't necessarily mean it is safe. It still contains nicotine, ultrafine particles, and many toxic substances. Many young people who vape have never actually smoked before. The existence of vaping presents an opportunity for these particles to enter the respiratory systems of young people who would otherwise not consider smoking. Vaping has been linked to lung injury, inflammation, and impaired immune response, which can worsen the effects of lung cancer. Myth number 6 is that if you've smoked for years, there's no point stopping smoking anymore. In truth, quitting smoking makes you less likely to get lung cancer and more likely to survive it. So even if you don't have lung cancer at this moment, or if you already do, cutting smoking can make it less likely for you to develop cancer and more likely to survive it. Lung cancer patients who quit at least 10 years earlier from their time of diagnosis are 3 times less likely to die than patients who kept smoking. So what can we do to reduce the risk of death of lung cancer, to reduce the risk of getting lung cancer itself, and to better prepare ourselves for when we do get lung cancer? Step number 1 is prevention. Of course, this means to stop tobacco use entirely, which includes both smoking and vaping, and also to try and reduce the exposure of our respiratory system to carcinogens in the air. We can also make healthy lifestyle choices, such as choosing to drink less or eat better diets. And if we do suspect lung cancer, early detection can be a very great tool in making sure that our outcomes are as best as possible. Any adult from 50 to 80 years old with smoking history should get screened regularly for lung cancer, at least twice a year, using a low-dose CT scan. And if you're not eligible for screening, you should know the early signs of lung cancer so that you can report them as soon as possible. Support systems are very important for the management of people who do get lung cancer. This includes psychological support, having access to palliative care, and having access to a community and family who are willing to help you and guide you through your stages of treatment. This will greatly improve your outcomes as well. Thank you for listening to our presentation, and we will see you next time.